So, thank you very much indeed for inviting me to talk to you this evening. Thank you to William Shakespeare for joining us. Looks like you're all teched up here. I think we need to have a word about cloud storage a bit later, though. And thanks to Hannah and Sophie for coming along today to give me a hand. You'll see or hear more from them later. So, my talk is about apps and what I call apptimism, which is defined up there. Who here who has a smartphone hasn't downloaded any apps to their phone? That's why we have smartphones, right? What about you, Shakespeare? Maybe not. Okay. But the fact is that there are apps for everything. There are so many apps out there. There's 1 million apps just on the Apple App Store. There's 1 billion downloaded in 1 month just before Christmas last year. The figures are absolutely staggering. There are 50,000 health apps out there as well, health and medical apps. So doctors are using apps, patients are using apps to help them manage their disease and keep away from the doctors. And patients, members of the public are using apps to stop smoking, lose weight, keep a healthy lifestyle. So there's a huge amount of apptimism that apps can do anything and everything. But I'd just like to tell you a few things which might make you feel slightly different about apps in healthcare. So the first problem is apps that promise the earth. An app here which claims to be able to read your blood alcohol level when you breathe on the smartphone. Well, there's no smartphone yet that has an alcohol sensor in it, so that's just not possible. Okay, it's marketed as a game to be used in parties and so on, but some people might just believe it, and that could have serious consequences. Here's another app which has some really weird ideas that somehow red light and blue light will cure your acne. Now, I know that Steve Jobs was a bit of a demigod, but still, that app has been banned by regulators because it's really making misleading claims. So there's a lot of strange apps out there which we need to get control of. Another big problem or challenge is privacy. And you might say, well, what would an app that reads your heart rate from putting the finger on the camera, what other functions would it require from you? What other privileges and permissions would it ask for? The answer is a scary whole range of different things. These are free apps, right? And this is the way they pay for them. They capture your data for marketing and so on. Hannah, this is a study that you've been doing. Do you want to just tell us about what you found in your study?
So I looked at the top 20 free apps in 2 different categories, a medical app category and a health and fitness category. And I found in the health and fitness category an average of 4 serious violations of privacy, and for want of a better word, only an average of 1 in the medical app category. The highest number of violations we had was 7, and the range is staggering, that the violations that occur, but perhaps the most serious that I came across were things like accessing your call list, accessing your contacts, and also your browsing history. Yep.
Thanks very much, Hannah. Yeah, it's a pretty scary business. And there's actually an article in the current issue of Wyatt about this problem that the data brokers out there are harvesting data from apps, harvesting data from social media, and they end up knowing quite a bit more about you and remembering a lot more about you than you know about yourself. So you could say, of course, we know about that already because we read the terms and conditions when we downloaded the app. So what are you telling us, Jeremy? This is no surprise at all. The trouble is those terms and conditions are very, very long. The app, the T's and C's for this app were only 1,200 words. But I'm afraid the T's and C's for some of the apps that you might use are as long as a Shakespearean play. Sorry about this, Shakespeare, but I don't think there's any rival there. So the fact is, you use the app, they get your data. It's as they like it, really. So another challenge is getting apps that are accurate enough. Now, let's take the situation with heart attacks. Heart attacks are very serious, and they do affect the young. So there's quite a lot of apps out there which try to calculate your risk of getting a heart attack over the next 10 years. And Sophie, this is an example of one of the apps that you've been looking at, and you looked at several. Do you want to tell us about what you did?
Yep, so we looked at 19 apps, and they were just designed to predict what your chance was of having a heart attack in the next 10 years, which is a test that GPs will use, and they will put you on medication and things like that to manage that. So we had various scenarios, and one scenario that we had that calculated at a 75% risk, one app calculated it with 21% and another calculated it with 136%.
Yeah, that's pretty bizarre. What does that actually mean? I mean, let's take Shakespeare here, for example. If I told you you had a risk of 136% of a heart attack, well, that's like you died and came back to life and then had another 36% chance of a heart attack. I didn't know you'd turn to Buddhism, Shakespeare, or is there some other explanation? So it's probably just a calculation error. But that's an example there where there's some serious problems with apps. Let's call it at least variable quality. So one of the big questions, I suppose, is can we improve apps if we pay for them? Is there a chance that the expensive apps are better quality than the cheaper apps or the free apps? And that's a very reasonable question to ask. But there are some other questions about whether the evidence, the claims that apps make, are actually justified. And you'll see that the claims made by one of the most popular weight loss apps there is really, there's no evidence at all to justify it. Whereas for another app, which actually comes from Leeds here, the My Mealmate app, they've actually carried out one of the very few randomized trials on apps, and that shows clearly that you will lose 5 kilograms of weight over a 6-month period, which is really very good. And there's no privacy issues with that app. If you want to lose weight, I strongly advise you to try that one, My Mealmate. So this question about paying for apps, do you actually get better quality if you pay more? And there's been a nice study in America looking at apps for stopping smoking. And they looked at 57 different apps. And what they did is they rated them for the quality of the evidence they were based on. They compared them with guidelines, like NICE guidelines. And you can see they had a score up to 60. And the first important point to notice that none of these 57 apps scored above 30 or 32 here. So there wasn't a lot of evidence there, I'm afraid. But the second and scary point was that there was no correlation at all between the cost of the app and the quality score. And in fact, there was one which cost $40 and had very, very low quality scale altogether. So the truth is that at the moment anyway, if you pay for apps, you're not getting good value for money. That's what the economists would call a failed market, I'm afraid. Another big question is, can you, the public, pick out the good apps? So is the wisdom of the crowd going to help here to bring the good quality apps up to the surface, up to the top of the App Store? I expect you all saw the bad apple there, but can we pick out the bad apps is the question. Well, again, we've reanalyzed that data from America on those 57 smoking cessation apps, and it turns out that the ranking in the display is not correlated. In fact, if anything, it looks like the better quality apps are ranked lower by the public and in the app stores as a result. So that's really weird. That's Web 2.0 turned wrong. And why is that? What's going on? Well, I've got some bad news for you, I'm afraid. There are click factories out there and Twitter robots. You pay $10, you can buy 1,000 tweets or 1,000 ratings of your favorite app. So the fact is that the wisdom of the crowd is being drowned out by the clamor of commerce, I'm afraid. And that's a real worry and a great disappointment for those of us who believe in user rating and the wisdom of the crowd. So the obvious question is, well, what can we do to get rid of some of these harmful apps? Shouldn't we be regulating to try and get rid of some of them? But the problem with regulation is a very blunt instrument. And you can end up regulating out innovation, regulating out some good things. And the other problem is that the words that the regulators use are not as lyrical and as carefully written as if Shakespeare was writing them. they are really hard to work out what is enforcement discretion here. And that's the American regulator. European regulators have similar rules. So we're really waiting to see whether regulation can help at all, and if so, where. Maybe for some of the more dangerous apps. You've got an app that controls a radiotherapy machine. Yes, that needs regulation. So we've come up with something which is complementary, a very different approach. It is about empowering you, the users of apps, to decide whether they're of adequate quality for you to use them. And we've come up with 6 criteria. I hope they make reasonable sense to you. First of all, who is it who published it? Have they got a vested interest in trying to make you think or act in a way that might not be what you want? Who is it intended for? If it's intended for doctors and there you are a patient or a member of the public using it, you might get it wrong, and vice versa. And what is it actually intended for? Is it intended just to capture and harvest your data, or is it actually going to do something useful? Another big question we've already seen is privacy. Where does my data go after I put it into the app? That's a big question. It's not always easy to find out that. In fact, it's often very difficult to find that out. Where did the content, what's in the app, where did it come from? Did it come from something recognized like a national guideline? And is it up to date? Are they keeping it up to date? Because that's important. Things change fast. And even if you've got good quality content, you don't necessarily get accurate advice. So if you can, test it with some sample input and see whether it's giving you sensible answers. That's the best you can do. But finally, what we should be encouraging app developers to do, and members of the public to do as well, is to evaluate apps. Actually find out whether they really do lead to the desired behavior change or whatever it is that the app is for. So those are our half-dozen criteria developed across a combination of UK universities and in collaboration with the Royal College of Physicians, where I'm advising. So in conclusion, it's all about you. We all love our apps, but actually we know that the quality of apps currently, particularly in health and lifestyle, just varies too much to be safe to use them. So what we need to do is to reflect carefully before we download them. Let's embrace Shakespeare's Brave New World. It was Shakespeare, not Huxley, who came up with that phrase, but cautiously. And so that's where caveat downloader beware comes in. So thank you very much. Thanks to Shakespeare, thanks to Sophie and Hannah, and thanks to you for listening.